I'm Missy, and today I'll be asking you some questions for Cancer Black Care. And your name is?
So my name is Professor Frank Chinegwundoh.
Okay. And could you tell us a little bit about your role in CBC?
Yeah. So Cancer Black Care, or CBC, as we shorten it to.
Yeah.
I'm the chairman.
Okay.
Or the chairperson.
Yeah.
Of Cancer Black Care, and I've been the chairperson since 1998.
Okay.
So I first got involved with the charity back in 1996 when the founder at the time asked me to do some talks about prostate cancer to community groups.
Yeah.
Because I have expertise in prostate cancer.
Okay.
My day job is a consultant urological surgeon.
Okay.
I work in London, not too far from here. Okay. So I work in East London as a urologist.
Okay.
And so I was the one who did the research that showed that black men have a high risk of prostate cancer.
Oh.
And so Isaac Berman asked me to do various community talks. I became a trustee in 1996 when it became a charity. And from 1998, I've been the chairperson of Cancer Black Care.
Okay.
And still continuing in that role through thick and thin.
Well, I'm sure they wouldn't have it any other way. In your own words, Frank, what does Cancer Black Care mean to you?
So Cancer Black Care means to me an organization that is there to support primarily the Black community in their cancer journeys. It's not exclusive to the Black community. Yeah. So anyone that seeks our support or whatever, here we will assist them.
Okay.
But its unique selling point is that it's culturally appropriate for Black people.
Okay.
It's Black led. The staff are Black, and so we get the community. Okay. So we get the kind of stigma. Yeah. We get the unnecessary shame. We get the isolation, and we're able to speak to people about that. So it's what it means to me is as a means of support. Yeah. There are very few Black-led charities in the cancer space. Yeah. And cancer affects 1 in 2 of us, and so we're able to provide support, provide information, befriend, go to hospital visits with people. We run support groups where people can get together and share their stories. Yeah. We bring in specialists to talk about diet, nutrition, and so on. So we give information as well. One of the big needs is navigating the whole benefit system and the whole social care system. Okay. You know, you're battling with your disease. Yeah. And your landlord wants to evict you because you may have fallen a bit behind with the rent. Yeah. Or your boss doesn't understand you have got to go for hospital visits.
Of course, yeah.
And so we can advocate on behalf of our clients. Okay. And also one of the big things that we do is lobby for better services for ourselves. Okay. So some years ago, many years ago now, if you're unfortunately you had to have a mastectomy and you wanted a breast prosthesis, there were only pink ones available. Not brown or not brown, any pink ones. And it was ourselves, Cancer Black Care, and 1 or 2 other charities that said to the NHS, this isn't good enough. Why can't we have brown prostheses?
Exactly, yeah.
You know, similarly, in years gone by, if your hair needed doing in hospital, you know, the white hairdressers, you know, with the best one in the world, didn't know how to deal with black
Afro hair, yeah.
And so we lobbied for that. Okay. And so at King's College, they introduced Black hairdressers to cater for the Black community. Yeah. And these services don't happen by accident. Of course. Someone's got to ask, someone's got to lobby, someone's got to speak to the various powers that be. Okay. So that's one of the things that we do. Okay. Screening is a big thing. A lot of women don't go for the breast cancer screen. Yeah. You know, and so we did some research to find out why, and we were able to get many of those women who hadn't paid heed to their letters to actually go and get themselves screened. Yeah. Okay. Prostate cancer, we are trying to get the government to say that all Black men from the age of 40 should go and get the PSA blood test. Yeah. Not wait for the man to know and then go and seek that. No, we want the NHS to invite men to get their PSA testing. Okay. And so a lot of what we're doing, apart from the client-facing work, there's also the lobbying of the ministers and the health service. Okay.
So could you give us one fun fact about you, Frank?
Just one?
Yeah.
Oh my God.
I mean, you can give 2.
Oh my God, that's going to be so tough to limit myself to one. But I'll give you one. I've done a fair amount of TV work, but the thing that I guess most people would know me for is I did this thing with the comedians, Carl Pilkington and Ricky Gervais and Steve Merchant.
Okay.
There's a program some years ago called An Idiot Abroad.
Yeah.
And one of the things that Ricky Gervais wanted was his mate, Carl Pilkington, to have an intimate male examination.
Yeah.
For prostate cancer.
Okay.
And so I was asked to go along to the studios and actually examine Carl Pilkington.
Okay.
And, the rest is kind of movie history.
Okay.
So, and it is abroad. It's still out there on the internet.
Yeah, I'm sure someone can find that online.
I'm sure they will.
So have you enjoyed today's event? How do you think it's gone?
Today's been marvelous.
Yeah.
Today's been so good, to occupy this space in one Canada Square on level 39.
Yeah.
We'd seen all these people that look like me in this space where we wouldn't normally be.
Of course.
I think it's great.
Yeah.
And I must say a big thank you to the Cancer Awareness Trust, particularly Tony and Kieran, for allowing us to use this space.
Of course, yeah.
And people have come from far and wide. We've had people from Devon.
Yeah.
People closer to home.
Yeah.
Male, female, we've had children, we've had much older people, all sharing this space and listening to each other. We've had great food, of course, and we've been entertained by poetry, we've been entertained by musicians, and we're raising awareness about cancer, and we're making connections with each other. Yeah. And I hope from here we will have volunteers that will help us carry on doing the work in the community that we've been doing for 27 odd years.
Of course.